Henry's regular morning walk suddenly took an unfortunate turn. Fortunately, his wife realized he was having a stroke. Remembering the spot stroke fast stick man, she quickly called 995 for an ambulance. Hello SGH, we have a stroke patient and are bringing him to your A&E now. The stroke team was ready and waiting when the ambulance arrived. At the hospital, Henry promptly underwent a brain scan, which showed that Henry had a stroke caused by a blocked blood vessel. Mr. Henry, you had reached the hospital early in the course of the stroke and will be able to receive treatment to save the affected brain cells. Henry was warded in the stroke unit for a few days, where he had a team of healthcare professionals caring for him. He was started on medications and taught ways to change his lifestyle to reduce the chance of another stroke. Thanks to his wife's prompt action, Henry was able to receive treatments that helped to limit brain damage caused by stroke. That gave him a better chance of recovery and independence after the stroke. Fast discovery helps recovery. Know the signs and remember to act fast.
Good morning, everyone. My name is Samuel from the SGH Patient Liaison Service. Thank you very much for joining us today in this special webinar focused on stroke awareness. The timing is everything for stroke. This is an initiative by SGH and the National Neuroscience Institute, Department of Neurology, to raise awareness on stroke. And through these sessions, we hope to give you some information on how to spot stroke, how to stop stroke, and especially how fast response can mean a word of recall like difference in stroke recovery. We have two speakers for today. The first is Dr. Sumit Kumar Sonu, who walked with us through the medical part. And the second speaker, our stroke survivor, Mr. Ananda Saruraja, who will share with us a more personal story of his recovery journey. So throughout the questions, please feel free to send the question to our speaker through the Q&A box. Remember, it's a Q&A box, not the chat box, okay? Because the speaker can only see the question from there. So without much further ado, Please welcome our first speaker, Dr. Sumit Kumar Sonu. Dr. Sumit, over to you, please.
Thank you, Samuel. Good morning, everyone. Welcome to this public forum on stroke. From Samuel, I'm not able to share my screen.
Yes, please share now, sir. Yeah.
Thank you so much. Yes, thank you so much. And welcome again for joining us on this Sunday morning for this public forum on stroke. I'm Sumit, one of the stroke neurologists from National Neuroscience Institute, working at Singapore General Hospital currently. So today I'm going to talk about understanding of stroke with the aim that at the end of this talk, most of you will be able to know your risk, how to reduce your risk for the stroke, and if somebody, in case if you or your family has discovered the stroke, what are the help available and what should you do? Few housekeeping rules here. So this talk will be for 20 minutes. Please turn off the microphone all times during the talk. We want to know who you are. Please log in with your real name. And if you have a question during this talk, please use the Q&A function via the Zoom webinar, and you put your questions there. We'll try to answer most of the questions, actually as many questions as possible. The 4 topics which I'm going to cover today's talk is what is stroke? How do we recognize a stroke? What are the stroke risk factor? How do we prevent the stroke? So what is stroke? Stroke in common term is a brain damage which is caused by interrupted blood supply to the brain. It is also known as brain attack. And there are 2 types of stroke. One type of stroke where there's a lack of blood, and we call it ischemic stroke. And it occurs because of blockage of blood vessel in the brain. And this blockage can happen because either of a blood clot or a fatty plaque inside the blood vessels. And this type of stroke is most common stroke, and it accounts for 80% of the strokes. Let me use this animated analogy and try to explain how does this ischemic stroke happens. So imagine if our brain is a garden and all the pipes there represents our blood vessels in the brain, and these plants and trees represent our brain cells, that is neuron. So as you can see in this animation, if there is a blockage in a pipe, there is no water flow beyond that. As a result, plants and trees dies. Same thing happens in our brain also. If there is a blockage of the brain blood vessels, it can be either because of fatty plaque or blood clot. The blood supply is compromised. As a result, the area beyond that, they won't have blood supply and they may die. And because of that, we get different type of severe function abnormality, like either weakness or slurring speech or speech problem. Second type of a stroke is hemorrhagic stroke. And this stroke happens when there is a leakage of blood from the blood vessels. What happens? Either because of some reasons, the blood vessels in the brain burst. As a result, blood leaks around the surrounding area, and there is a compromise of blood to the area supplied around. And as a result, we get a stroke, hemorrhagic stroke. And this type of stroke accounts for 20% of the total stroke. Similar analogy here, you can see there is a rupture of a water pipe. As a result, there's a leakage of the water, and as a result, there is a plant dies, and same thing happens in our brain. How common is a stroke? So 1 in 4 person suffers from stroke in their lifetime. Stroke can happen to anyone at any age, at any time. Stroke is number one cause of adult disability and fourth cause of death all over the world. In Singapore alone, we see every year 8,000 stroke cases. And as we all know that Singapore is a growing population, aging population, the number of stroke in Singapore will go higher. That's why we need to diagnose it early, try to prevent it, and if it has occurs, try to treat and make sure that disability is minimum. What are the consequences of a stroke? Stroke not only impact the victim, they also impact the patient's family, the society, even the healthcare. Physically, once the stroke happen, the victim may not able to walk, may not able to use their limbs. Sometimes even they won't be able to speak. And there are chances that these patients may need assistance for their day-to-day activity, like for bathing, eating, walking. Because of the speech affected in a stroke, many times patient cannot have good interaction with their family and loved ones. As a result, their social interaction get affected due to stroke. Stroke also affects one's mood and causes emotional distress. At the same time, because of a stroke and disability, patient may have financial liabilities, like they can lose their job either permanently or temporarily. They may also have more financial liabilities, either because of they need to expense more money on the hospital bill or on the rehabilitation. Stroke does also affect our cognitive function. Cognitive function means once to think thoughtfulness, how much you can think. And stroke itself is a second most common cause of dementia, which we call vascular dementia. Many of my patients ask me, is a stroke treatable? Yes, stroke is treatable, and early treatment helps to improve the outcome. So if you recognize either you or your nearby or your loved ones is having symptoms of stroke, please call 995, because immediate attention and medical treatment may reduce the stroke disability and also may help them to recover faster. Our brain is very sensitive to blood supply, so we should act faster, because if you delay, more brain cells will die. We always use this word, time loss is equal to brain loss. So act immediately if you consider there's signs of stroke. So what we neurologists do for the stroke if the patient comes to our hospital? There are two main treatment which we do for any acute stroke. One of the treatment is clot dissolving medication. And this medication is given via intravenous plug, which is set either in patient's hand or maybe in the elbow. And then we inject this clot dissolving medication. Let's see the animation, how this clot dissolving medication works. So you can see there's a clot, and as a result, there's no blood supply. But when we give this medication through injection, this medication goes everywhere in the body. And when it reaches into brain, they dissolve the clot. As a result, blood flow is restored. And that's how we can save the nerves or neurons in the brain. This treatment is time sensitive. This can be only given to the patient who comes to the hospital at 4.5 hours from the early signs of stroke onset. So it means if somebody has stroke at 6 o'clock morning, and if they are coming hospital within 10:30 morning, he'll be eligible for this kind of medication. This medicine is only available in hospitals where it is given by neurologists, because they need to assess the patient, make sure there's a stroke, and also they have to make sure there's no contraindications for giving this medication, because this medication can cause sometimes bleeding. But it's very good medication, because if it's given on time, almost 30% of people can be independent after 3 months of the stroke. Then second type of treatment which neurologists or which we do in hospital is endovascular therapy. And this type of therapy is given for those stroke where there's a blood clot in the larger artery in the brain. So what does doctor do? So doctor insert a very fine wires through the patient either wrist or groin arteries, and then they spread it through the all arteries and reach to the brain. And after that, they try to remove the clot, and as a result, blood will be again flowing in the brain, and then stroke has less effect after this, as you can see in this animation. So wire goes up in the brain and then they suck the clot down. This is very specialized procedure, can only done in hospital and only done by our interventionist. And there's a time, this is also time sensitive, and this type of treatment can be given up to 6 hours from the early signs of stroke. Now, how do we recognize stroke? I think many of you may have seen this poster in social media and other places in Singapore. We do have a fast screening, and this screening helps us to diagnose stroke early. Up to 75% of the stroke can be picked up alone using this fast screening. Let me go through how this fast screening works. So fast screening, F stands for face drooping. So you have to look whether there is a face drooping on the individual who's having stroke or who is feeling that he may be getting stroke. So is there a face drooping on the one side? A stands for arm. Is there any arm weakness, either one side or both sides? H stands for speech. Is the speech is slur? Is it strange? Is the patient is not able to talk? Can he understand us or not? If it's anything is there, then it can be signs of stroke. Next is T, which is very important here, and T stands for time. If you see any of such sign, please call ambulance immediately, and then patient can go to hospital and get the treatment. As I say, 75% of the stroke can be picked up by fast screening alone, but there are other signs of the strokes, and these signs are sudden onset. Remember, sudden onset means it happens very fast. If there is a sudden onset of numbness, either in the hand, face, or legs, this can be signs of a stroke. If individual has swallowing difficulty, that means he cannot swallow water or food, and that has happened suddenly, this can be one of the signs of stroke. Change in vision is another sign of stroke. It can be either blurring of vision or sometimes even can be loss of vision. So please look out for this change in vision. Unsteady gait is also one of the signs of stroke. So suddenly patient cannot walk or feel that he's walking and he's waving to the one side. This can be sign of stroke. Giddiness is very important sign of stroke. Though there can be many causes of giddiness, it can be also from the imbalance of ear, but any giddiness, if it happens suddenly, please do call see doctor or call 995 because you may be having stroke. Headache is very important sign of stroke, and generally it happens in hemorrhagic kind of stroke, and patient have they say that they have a worse headache of their life. Now, let me do one polling and see whether you guys can recognize stroke using this fast screen. So I'll read the scenario and see how much you guys try to help us to the poll. So the question is, Madam Tan is having dinner with her family in a restaurant. Suddenly she feels weak and sways to her left side. She's unable to pick up her spoon using her left hand. Question is, does Madam Tan present any signs of stroke? What will you do if you are Madam Tan's daughter? And the options are A, call 995 for ambulance, bring Madam Tan to clinic next to the restaurant, and C is drive Madam Tan to nearby hospital. Let's see. You guys can poll for this, and I'll wait for your answers for at least 45 seconds. Samuel, can I have answers, please? See the poll results. Great. So we can see as here, 83% people have selected call 9995 for ambulance, and it's correct. Why we shouldn't bring Madam Tan to the clinic next to the restaurant or to the nearby hospital? Because see, when you call 995, there are few things kicks in place. Not only ambulance comes to your place to see the victim, ambulance also helps to activate our stroke team in hospital. As a result, when you reach hospital, they are already alerted, and they can receive you in emergency department, and so that you don't waste time in queuing in emergency department to see the doctor. And then doctor analyzes you and see if you need a stroke, if you have a stroke and you need appropriate treatment for a stroke. That's how you can save the time. So if you discover anytime anyone nearby you is having stroke, please call 995 rather than taking him to nearby hospital or clinic. Next scenario is, Agao woke up in the middle of the night and went to the toilet. He suddenly felt weakness in his left leg and was unable to walk steadily back to his bedroom. If you are Agao, what will you do? And your options are call 995 for ambulance, go back to sleep, or wait and see few hours before calling 995. Please vote for this. Okay, let's see the results again. And yes, you guys are absolutely correct again. Thank you so much. So call ambulance, 81% people have chosen it. And that's the correct answer. Call the 995 for ambulance. I won't advise to go back to the sleep, because if you go back to sleep or you wait for see whether you are recovering or not, you may be missing the golden hour when you can go to hospital and doctor can see you and can give you those standard medication to treat stroke. So always remember, time is everything. Like our talk says, in stroke, time is everything. If you diagnose, you suspect you have or having stroke, please call 995. I want to also bring 2 points here. Stroke may not every time come when you are awake. There are sometimes patient can get stroke have stroke symptoms when they are in sleep. So when they wake up, what they should do? And my patient do ask me, hey, doctor, what should I do? My one friend, he woke up with a stroke. What should he do? So this kind of stroke, we call it wake up stroke. And if somebody has this wake up stroke, it can be treated same like a normal stroke. So if you think that you wake up and you are having stroke, please call 995 and go to, so that ambulance can bring you to hospital. And then hospital, the neurologist can assess you, and then depending upon your symptoms and everything, they can give you the treatment. Another scenario I want to bring it, there are patients calls me, says, hey doctor, I had a right hand weakness and I was not able to talk for like 1 hour, but it resolved and I didn't go to doctor. What should I do if I happen next time? So my advice for everyone out there is, if anytime this happens, if you have, it means you have a transient weakness, numbness, or slurring of speech, or any neurological symptoms, and which has recovered after some time, like within 1 day, you must see a doctor or call 995, because this is called warning stroke. And patient who has a warning stroke, they have a higher risk of getting another stroke. And we don't know if next stroke will be how debilitating. They may be not able to talk. So don't take it lightly. If any neurological symptoms you feel, please call 995 and go to hospital. Let's see what happens when we call 995. So like I said, when you call 995, you get ambulance at your home, and ambulance comes and assess you. And then they decide to transfer patient to the ED. They also do some preliminary checkup, ECG, and that time they activate hospital, our stroke team, pre-stroke activation, we get it. And as a result, stroke team and emergency doctor will meet you at the door of the emergency department. There, the neurologist assess you, and then they bring you to brain imaging to see whether what kind of a stroke it is, whether stroke has really occurred or you have any bleeding inside the brain. And depending upon if you have fits in to any of such treatment, like either clot dissolving treatment or thrombectomy treatment, doctor will discuss with you, consent. They'll give you all the risk and benefit advice. And then after that, you'll go for procedure. In case if you are not able to get this treatment, you will be still get admitted to our stroke unit, and you will be given medication and monitor very closely so that your blood pressure and everything is normal and you don't get, your stroke doesn't worsen. In all cases of the stroke, they generally come to our stroke unit, where you will be monitored very closely by our trained nurses and the doctors. So that's why we always tell, if you think stroke, call 995. Don't waste time. Time is everything. What are the stroke risk factors? So stroke risk factor, I divide into two types. The risk factors which can be changed either by our healthy living style or by the medications. This type of risk factors I call modifiable risk factors. And these are hypertension, smoking, obesity, healthy diet, unhealthy diet, low physical activity, diabetes, heavy alcohol intake, psychosocial factors, high lipids or abnormal lipids in your blood, atrial fibrillation. Whereas the risk factors which cannot be changed, they are non-modifiable risk factors, and they are male gender has higher risk of stroke than female gender. If you have a history of a stroke, or if you have a family history of a stroke, your risk of stroke increases. Similarly, risk of stroke increases in increasing age. So as you grow up, our risk of stroke becomes higher. The most common risk factors for strokes are high blood pressure, smoking, and atrial fibrillation. What is high blood pressure? High blood pressure means your heart is pumping blood into your other body parts at a high pressure. And as a result of high pressure, you can get injury to those body part. Like if it goes to kidney, you can get kidney injury. If it high blood pressure in a brain, you can get a stroke. In heart, you can get heart attack. And uncontrolled high blood pressure increases stroke risk by 4 times. 1 in 2% from the age 60 to 69 have a high blood pressure. 4 in 5 stroke patients, which we see in hospital, they have a high blood pressure. High blood pressure generally may not give symptoms. So it means that patient has a high blood pressure, but he may not have symptoms. Rarely they may have symptoms like headache, giddiness. Therefore, important that you should go for regular health screening so that doctor can pick up if you have a high blood pressure early, and then they can discuss with you and start you on some treatment. Either it can be healthy living style, or it can be medications. If you have a high blood pressure, your blood pressure should be maintained less than 130/80 or advised by doctor. I won't go to this number 130/80 because every individual is different. They may have a different underlying disease. So please, if you have a high blood pressure, you see the doctor, either GP, polyclinic, or any other doctor, and see what target they are setting for you, and try to be compliant on those medications. Smoking is a risk factor of stroke. I personally feel smoking is a killing stick. It has more side effects than benefit and no benefit. It can cause not only cancer, it can cause you heart attack, it can cause you stroke. And one studies has shown if you stop smoking for 20 minutes, your body starts healing. And if you quit smoking for 2 to 5 years, your stroke risk drop to about the same as that of non-smoker of the same age. If you are keen to follow smoking suggestion, you can see either polyclinic or doctors, and they have many smoking suggestion programs. In case you guys are keen, you can go to this website, www.healthhub.sg programs quit. There are many programs available which can help you and guide you how you can quit smoking. Next is atrial fibrillation. What is atrial fibrillation? Atrial fibrillation is a disorder of heart rhythm where heart is beating irregular As a result, there is a blood clot will be formed in the heart. And when this blood clot moves to the brain, they can block off the brain blood vessels and cause stroke. With increasing age, we see more patients have atrial fibrillation. Atrial fibrillation increases the stroke risk by 5 times. We also, in our hospital, in stroke patient, we see 1 in 5 stroke patients have heart atrial fibrillation. This atrial fibrillation patients should be treated with blood thinning medication, which is different from aspirin or any other normal stroke prevention medicine. This can be either warfarin or some other very strong medication for blood thinning. Another question which people ask me, is stroke preventable? Yes, 80% of strokes are preventable. How we can prevent this stroke? So we can prevent stroke by living a healthy lifestyle. And this can be done by stop smoking, quit smoking, limit your alcohol intake. That means if you're drinking, don't drink more than 2 standard size of your drinking. Exercise regularly. Keep your BMI between 18.5 to 22.9, because obesity is another risk factor of stroke. Patient does ask me sometimes, doctor, how do I know that I'm exercising adequately? So for the normal healthy exercise, you should exercise 150 minutes per week. It's not much. So it means 30 minutes per day for 5 days. If you exercise, it is enough to keep you healthy. They also ask me what type of exercise I should do, doctor. So my suggestion is you should do moderate intensity exercise. What is moderate intensity? Any exercise which makes you sweat at the end is moderate intensity exercise. I'll also express one point here. If you have been not exercising for very long before getting into any exercise program, please see your doctor and discuss with him, because suddenly starting exercise also can have bad effect on your body. Another thing is healthy diet. What is healthy diet? So as you can see in the picture, the healthy diet consists of 50% of your plate should be made of fruits and vegetables, whereas quarter should be made of proteins, which is coming from mainly meats and fishes, and rest quarter should be made up of whole grains, and this will make your healthy diet. Go to regular health screening. If you are 18 years and above, you should go for yearly screening for obesity, and go every 2 years or more frequently if your doctor has advised for high blood pressure checkup. Because I said many of the patients which has high blood pressure, they may not have symptoms, and it can be picked only on the health screening. If you are old, 40 years and above, you should go for every 3 years screening for diabetes and high cholesterol. And in case if you have a high cholesterol, high blood pressure, diabetes or atrial fibrillation, you should attend medical appointments as advised. Sorry, I just drink some water. Yes, sorry. Yeah, so you should attend your medical appointments as advised and take medication as prescribed and maintain healthy living lifestyle. So in summary, what till now I have talked about, I talked about what is stroke, how many types of stroke we have, what are the consequences of stroke, how can we recognize stroke using the FAST screen. We also talked about what are the risk factors of the stroke. Most common type of risk stroke means stroke risk factors are high blood pressure, smoking, and atrial fibrillation. How can you prevent the stroke? By living a healthy lifestyle, going for regular health screening, and taking the treatment or medication which is prescribed by doctor regularly. Now let's see one of the video which is made for stroke awareness.
is everything. Stroke is treatable when you act fast.
Let's see another video which we have created for stroke awareness.
To spot a stroke, think fast. Face drooping, arm weakness, or speech difficulty means it's time to call 995. Fast discovery helps recovery.
Every year, we have on doing this National Stroke Awareness Campaign. And this year, our theme is Timing is Everything. And these are the posters you may see in the public domain for Stroke Awareness Campaign. In case if you guys want to know more about stroke, what we do, and you can follow us on Spot Stroke at Facebook and Instagram. In case this is another very good site for getting more of, I'll go back again, getting more of information about stroke is Stroke Hub, where you can get a stroke guide for stroke survivor and their caregivers. This Stroke Hub is very nice. It can also teach you many things about stroke. So in case if you're interested, what are the different types of stroke? What are the causes of stroke? If somebody has stroke, when they go hospital, what the doctors do? What are the rehabilitation programs available? Everything is there in this Stroke Hub. So if you want, please scan this QR code, or you can go to this Health Hub SG and you can Google many things about the stroke. There are also videos there in many different language. We have in Malay, Mandarin, Tamil, English. There are videos for both stroke survivors, stroke patients, and in their caregivers. So if you are keen, please do go there and make use of it.
Strokes are preventable. Lead a healthy lifestyle. Manage your blood pressure and quit smoking. To prevent stroke, know your risk, reduce your risk.
That's all from me. Next, I'll be inviting Mr. Ananda. He's a stroke survivor. And Mr. Ananda started, let me tell a few words about this gentleman. So he's started his Athos group in 1983 when he was 26 years old. He built it to one of the largest spa and wellness company. In 2011, he employed 450 staff and had 60,000 square feet of wellness space. But in July 2012, Mr. Ananda had a devastating hemorrhagic stroke, and that forced him to rest and recuperate for more than 9 years. That time, his wife took over his company. Currently, Mr. Ananda is one of the stroke advocate who does sharing of his stroke journey. He has even written a very nice book. I'll hand over to welcome Mr. Ananda, the great man himself, and try to learn from his journey. Welcome, Mr. Ananda.
Thank you very much, Dr. Sumit, and thank you to Singapore General Hospital for inviting me. Timing is everything for stroke. This was in 2009, where I was a recipient of Spirit of Enterprise. But on 3rd July 2012, I had a very serious hemorrhagic stroke. At that time, the doctor did not tell me how serious it is, but 6 months after my stroke, a doctor friend told me I was lucky to be alive because the basal ganglia is a very central part of the brain. And this is a picture in 2019 at a seminar. Today, I shall be covering the following, right? Sharing my stroke journey and recoveries post-stroke, most useful communications on healthy living after stroke, what healthy living information I would like to see more of. My story tells me we must prepare our young early. Stroke awareness material should be targeted at the young early so that they understand the impact of stroke. Globally, 1 in 4 adults over the age of 25 will have a stroke in their lifetime. 13.7 million people worldwide will have their first stroke this year, and 5.5 million will die as a result. As Dr. Sumit said, time lost is brain loss. Every minute counts. So why is it so important to target the young early? My daughter was then only 18 when I was 55, when I had my stroke on 3rd July 2012. It was a devastating hemorrhagic stroke of the basal ganglia. It affected my family and my business. My daughter's response to the news when she heard about me being in hospital, "Your dad had a stroke. Come to hospital now as fast as you can." My daughter's response, "How prepared were you when your dad had the stroke?" She didn't know what is a stroke. Will dad be conscious when I see him? Is dad going to survive this? Why did this happen? Will daddy even recognize me? And to tell you frankly, I did not know anything about stroke. I had never come across anyone who had a stroke when I was 55 and had the stroke. Materials should target the young to prepare for this. My story of stroke highlights the need for stroke awareness materials to be inclusive of caregivers. Thoughts of stroke caregivers. They go through a steep learning curve. They experience a reversal of roles. It is a journey of many small steps. Gaze fixed on short-term goals to avoid being overwhelmed. They need support, close friends, family, and supportive associations. Grieving the loss of what was and the uncertainty of the future. Varied emotions, confusion, anger, distress, sorrow, but also joy and hope. Time allowed greater adjustments and acceptance of the situation. Communications to include advice for caregivers. Remember to take care of yourself too. Reach out for support, emotional and practical. Link up with Singapore's National Stroke Association, SNSA, to meet with other stroke caregivers, support each other, and lend a good listening ear. Work on short-term goals to avoid feeling overwhelmed. Remember to take this journey one step at a time. I realize the importance of having a comprehensive guide for caregivers along their journey of caring for their loved ones. My stroke journey highlights the importance of stroke awareness materials to reach out and guide stroke survivors through their journey towards recovery and return to society. These are information I found useful. Let me share about healthy living after the stroke that I found most useful. But first, what caused my stroke? My unhealthy lifestyle before my stroke. I was inundated with stress. I thought that business was so important, but how wrong I was. How wrong. Unfortunately, 6 months before the stroke, I was not sleeping well, and the effect of that is my stroke. My healthy lifestyle after my stroke. My journey towards recovery, 3rd July 2012 to October 2021. What did recovery mean to me? Where I was unable to get out of bed without assistance in the 3 months that I was in hospital. In the 2 weeks after my stroke, I could only utter a single word, can. What did recovery mean to me? My unrealistic expectations within 6 months of stroke onset. I thought I would be able to walk independently. I thought I could drive on my own. I could return to the office, communicate fluently, return to roles of husband and father. But that didn't happen. In reality, it took 1 year for me to be able to speak fluent sentences, 2 years post-stroke, and still not involved in the day-to-day running of the business. Aphasia was discovered. Thus, I still feel challenged to communicate when in a group. Only 6 years later, I was able to return to my former rate of reading. Now 9 years and 4 months, I am here. Healthy living should include the care of the lymphatic system. I found information about how the body works and how I can support it better. I found this both useful and empowering. Paralysis results in clogged lymphatics, a plight of stroke survivors. What I found most useful for healthy living after stroke: how to build a healthy lymphatic system, how to manage the effects of stress on our body, how to inculcate these lifestyle practices early in life. I had a daily watch over my health. I monitor my blood pressure daily. These are information I found useful, and I would like to see more of these healthy living information and messages for stroke awareness programs in Singapore. I was at life crossroad when I decided to move out of my plateaued stage of stroke recovery 2 years after my stroke. I attended a 6-day seminar, Lifeline seminar in Adelaide with Dr. Darren Wiseman. And then I found that my stroke was a gift in strange wrapping paper. You might wonder why. I decided in 2014 that I want to write a book. The title of this book is Stroke of Gratitude. And it's taken 7 years for me to slowly get this book out, but this book will finally be launched in the first quarter of next year. What we discovered about the lymphatic system during the critical 3 months in hospital enabled me to recover faster than expected, and even came back to an active lifestyle. You can see this picture in 2002, which is 10 years before my stroke. I cycled together with 30 other cyclists from Ipoh to Singapore to raise money for a charity. The second picture is in 10 years later, in 2012, I was in the hospital for 3 months. And then in 2016, I joined in a charity ride, but this was a spin bike, stationary spin bike to raise money for a charity. And then in 2017, I was with friends trying to get back into business slowly. So my journey towards my recovery. In the first and second year, I had regret. I had grief. Why me? Isolated. In the third year, there was a paradigm shift. that my stroke is a strange wrapping paper. It's a gift in strange wrapping paper. And I started to talk to other stroke survivors, trying to help them as much as I can. In my 4th and 6th year, I was more involved in the community. I was very much involved in SNSA. I found that the programs that SNSA does really helped me. Things like meditation, dance, lots of things that really helped me so much. I found myself having a community who could help me, and it definitely helped me so much. So in the 7th and 9th year, I was well enough to accept a position in SNSA committee, right? And it empowered me to contribute back to the stroke community in Singapore. I want to work with SNSA to increase awareness of stroke in Singapore, and that stroke is avoidable. And this is my journey with SNSA, right? It was really a fun place for me to go to. Before I know SNSA, I was feeling very lonely. And after I came to know SNSA, there were so many programs that they were organizing that helped me to heal my body. And I was nominated to the Exco in 2019. So I was there 2019 to 2019 to 2020, yeah. And I went back and did talks either in the library or in companies and shared my story of my recovery. More information I found useful. I highly recommend 7 to 8 hours of sleep, a healthy plant-based nutrition. I do exercise and yoga. Yep, I do that. And in conclusion, let me end my sharing on a positive note. Stroke survivors must continually challenge the status quo they are in. The story about the mother giraffe: we fail, we fall, we become hopeless. Hopeless is the biggest enemy of success. If you become hopeless, you will lose everything. Whenever you feel hopeless, you must remember the mother giraffe's story. It explains when the baby giraffe comes out, he expects the mother to look after him, but the mother just kicks him and kicks him and kicks him until he can run on his own. The reason is that the mother giraffe is worried about ferocious animals who like to eat a baby giraffe. So she puts a lot of pressure on him to go and run, right? In life, challenges will come and we will fail and we will fall. Whenever challenges come your way, no matter how many times you fail, learn to get up and stand up. Get up and start running. If you learn to get up, stand up, and start running, then you will find the highest peak of success. Thank you very much. Over to you, Samuel.
Thank you, Mr. Ananda, for sharing your insights in your journey. It was really amazing to hear from you again. Next, we'll be going for our Q&A. And Mr. Samuel will help us to flash the questions. We'll try to answer as many questions we can with this limited time constraints we have. And so questions, I will take the questions if needed. Dr. Shamla is also there. She is president for SNSA. And if you have any questions from her, you can ask her. And then Mr. Ananda is there.
Dr. Sumit, maybe you can start with a question first. Which question you want to answer first, please? Yes.
You can flash any questions which we have selected. I can try to answer, then we can go ahead with that.
Okay, is this the first questions? Do you see the screen?
No, not yet. Yes, I can see the question. Yes. So there's a question, does having one kidney leads to heart or stroke problem? It depends. This question depends. So how is that kidney? That kidney is good or it's not good. I mean, it's not working. Either they have kidney is failing or they have kidney problem. Then yes, it can cause risk for a stroke or heart problem. But if your kidney is functioning very well, and you have one kidney, either you have lost other kidney because of some surgery or because of some childhood abnormality. In that case, one kidney is enough to function for both kidney. And in that case, you won't have risk of stroke. But if your kidney is not functioning well, it means that if you are going to having chronic kidney disease or acute kidney disease, or you have end-stage renal failure from one kidney, then you have higher risk of stroke. Because of the kidney failure, you can start getting plaques, fatty plaques around your blood vessels, and which will increase your risk of getting both hemorrhagic and ischemic strokes. Next one, can we have Samu? Yes, so next question is headache a sign of impending stroke? So like I discussed in my talk, headache, sudden onset headache is a sign of impending stroke. And this kind of headache, generally patient will say that they have a worst headache of their life. And it happens generally if they have either bleeding or anything causing increased pressure inside the brain. But if you are having normal, means if you're already having headache for many years, that one-sided headache, which can be either migraine or some tension-like headache, that it may not be signs of headache. But always remember, if any sudden onset headache is there, it can be sign of stroke, and you should consult a doctor. Or if your headache is very bad, you should call 995 or go to emergency department. Can we have a next one? How do we reduce risk of getting stroke? So like I discussed in our talk, and Mr. Ananda also shared his thoughts about this. So we can reduce the risk of stroke by following the healthy living lifestyle. Limit your alcohol drink, stop smoking, do exercise, reduce your BMI, and take a healthy diet. Apart from that, if you have any risk factors for the stroke, like atrial fibrillation, diabetes, high cholesterol, go to doctor, follow their prescription, take the medications. Next one, please. During the stroke, would intentional coughing has a same effect like CPR? Help the cough to recirculate and save the person. So this is a question is both yes and no for me. Yes, in the sense, yes, when you cough, it does affect like a CPR. So what happens when we cough, our pressure inside the chest become more. As a result, your heart will have more pressure and the heart will pump. But can it save the person from the stroke? I will say no, because the pressure increase depending upon what kind of stroke you have. If you have a stroke from atrial fibrillation, that means if your clot is sitting inside the heart, if your pressure is increased, there is chance that one more clot may dislodge and go into the brain and you can get another stroke. Same time, if you have a stroke from the bleeding inside the brain, hemorrhagic stroke, and if you are coughing and it increases your blood pressure, the risk of bleeding in the brain will be higher. So I won't advise for this, but yes, your first sentence is not wrong. Intentional coughing has the same effect like a CPR, but it's not advisable for the stroke patients. Can we go to the next? Next question. Understand that atrial fibrillation increases the risk of stroke. How do we detect and treat atrial fibrillation? Very good question. So let me tell you a few things. The atrial fibrillation can be two types mainly. One can be paroxysmal, means it is not there always. It only comes and goes. And this kind of atrial fibrillation is very difficult to pick up. And for that, we need a prolonged monitoring devices. That happens in hospital. When you go to hospital, you will be put some wires inside your chest, on your chest, and then they can monitor your heart rhythm. It can be either by a telemetry, or sometimes they even hook some machine, which we call Holter, which will monitor for 28 to 48 hours. And if sometime longer, even they insert in your chest wall, we call loop recorder, which can stay for a few years and try to pick up if they have a paroxysmal heart atrial fibrillation or not. Other kind of atrial fibrillation is persistent atrial fibrillation, means patient has always atrial fibrillation, and that can be picked up by doing normal 12 lead ECG, which can be done by any GP polyclinic or even in a doctor's if you go to hospital. Next question is, how do we, I still go to complete my atrial fibrillation. How do we detect? I finish it. How can you treat? So treatment of atrial fibrillation is very specialized and it should be done by doctors. So because there are few contraindications, the medication given for atrial fibrillation is very strong. It has side effect. It can cause bleeding. It can cause bleeding in any other parts of the body. So doctor need to weigh a risk for bleeding and assess, and then they have to discuss with you various medication which is available for atrial fibrillation. And there are many medications for atrial fibrillation, even surgery is available. So I guess if your loved one or anybody has atrial fibrillation, you should see doctor rather than starting medication yourself. Okay, Samuel, next one, please. I had a brain aneurysm in July 2014. What are the follow-up and I should do? Okay, so brain aneurysm generally can cause hemorrhagic kind of stroke when they rupture. And generally they are followed by neurosurgeon, and you may need either 6 monthly or yearly scans to see whether if your aneurysm is growing in size or not. And so that's why you should see a neurosurgeon and see follow-up. There are chances if your brain aneurysm is very small, doctor may not follow up because the risk of different sizes of brain aneurysm has different risk of bleeding or rupturing. So then NES may decide that whether you can be discharged to polyclinic or not. Another thing which is very important for brain aneurysm is the blood pressure control, because if you have higher blood pressure, chance of aneurysm rupture is higher. Okay, next question. My mother had a stroke in India and she did not survive, though we had taken her ICU, but maybe we got delayed. Doctor mentioned about 30% of the brain is affected. Would there be better chances for her treatment if she was in Singapore? Bit of hypothetical question for me, because difficult for me to say what is there in India, what is not there in here. But yes, if patient was in ICU, I may suspect that she may have a very big stroke. There are chances that if she's here, maybe bit difficult for me to comment on this because I don't know what kind of stroke she had. But yes, obviously, if she goes hospital early, she can be treated well. In Singapore, yeah, we take stroke very seriously. We have very good stroke system here with nurses, doctors, physiotherapy, everything. So we do see good recovery post-stroke. And even for the acute stroke, we have many treatment available. Can we go to the next one? Can low blood pressure cause stroke? What are the causes of low blood pressure? Is there anything you can do to raise blood pressure? Okay, so generally low blood pressure will cause you giddiness or syncope. Maybe you'll feel giddy, you can lose your consciousness. Strokes generally don't happen unless you have a blockage in your big arteries, either in your neck or inside the brain. So that when your blood pressure is low, blood doesn't flow into your brain and you can get stroke. There are many causes for low blood pressure. It can be either because you are thin, your BMI is low. Generally females, they can have blood pressure low because of they are losing bloods on their periods. They may have low hemoglobin. So there are many numbers. How you can raise the blood pressure? You should eat healthy, exercise. And if blood pressure is really low, you should go to doctor and see if they can try to find out why your blood pressure is low rather than taking medication at home. Can we do our brain scan for early detection of a stroke? So as per studies and research, brain scan is not advised if you don't have symptoms, because brain scan has X-rays and it has like almost one CT scan is like 1,000 X-rays. So more side effects it has. Not only that, if you don't have stroke, and it will put another risk for you for getting this X-rays. So generally, brain scans, we keep it for the patients who had a symptoms of a stroke or any other pathology which we suspect in the brain. So I won't advise brain scan and routine to do to detect early stroke. Is it advisable to take aspirin, though no stroke before? I was just detected to have blockage in 2 arteries. My doctor said it was to lessen the severity of stroke strikes. Okay, so yes, if you have got blockage in your arteries, either in heart or somewhere else, aspirin can be given so that it can prevent the further blocking or increasing the size of the blockage. But I won't advise for taking aspirin if you don't have any blockage in arteries or stroke symptoms, because all the studies have shown if you have no strokes and you are taking only primary prevention for the stroke aspirin, it has more side effect, more harm than benefit. Is it better to call 995 or make our way? Okay, I think we have discussed about this in our slides and our talk. Maybe we go to next one. If one is staying alone, what shall one do if one find that he or she has a symptoms of stroke? Will one still capable to call 995? So there's two questions. Let me answer the second one first. So depending upon what kind of stroke patient is getting, he may be able to call or not. If a stroke is very big, that means he's not able to move one side. He's not able to keep himself awake. He's not able to talk. Then there's chance that he may not able to call 995. In that case, it's a bit difficult, but if any family member is around, they may be able to help it. But there are chances it happens when patient is somebody is staying alone. We may be able to miss it, and patient may only come after few hours when somebody has noticed they have stroke. But if your stroke symptoms are very minor, means only one hand weak or one side weakness, but still you can use your right hand, you will be able to call 995, or you can call for help so that your family member or some loved one can call 995. Next question is, if I'm staying alone and if I have stroke, what should I do? So I will advise you, if you are staying alone, if you can still walk, you could go to neighbor and tell them so that they can and ask them if they can call 995. If you can call yourself 995, if your stroke not big, make sure you don't drink or eat sometime that time, because you don't know how your stroke will progress. And if you drink or eat, there's chance that you can choke on them. Don't take any medications because you don't know what kind of stroke you have. Because sometimes people think that aspirin taking will prevent stroke, but yes, it can prevent ischemic stroke, but it can be deadly if you have bleeding inside the brain. So you don't take any pre-medication if you suspect stroke. Go to the hospital and let doctor decide about it. And most important, I'll stress on this, if you have a symptom of stroke, please don't drive. Please don't try to drive and go hospital. It won't be only fatal to you, it may be fatal to other people also. So in case if you are driving and if you feel stroke or anything, stop the car there itself on the side and try to call 995 rather than driving yourself. Can we go to the next, please? I knew a girl around 30 years old and who has a stroke. May I know why young people can stroke? Very good question. So like I said in my talk, aging people has a stroke, but we do know that young people also can have stroke. And this is we call young onset stroke. And like in my talk, I said there are non-modifiable causes of stroke. So if you are male, you can have high risk of stroke. If you have family risk, you have high risk of stroke. Not only family risk of stroke, if you have any other problems, other coagulation problem, means your blood is clotting a lot. If you have any autoimmune problem, if you have early diabetes, or if you are very stressed, stress also can cause changes in our blood vessel, and then we can cause stroke. Sometimes even you can have heart hole inside the heart, we call PFO. That can be the cause of stroke in the young people. So young stroke is also very common. Yes, next one, please. If one is suspected of having stroke based on a fast, while waiting for the ambulance to come, should patient take Panadol first? Like I said just now, please don't take any pre-medication before stroke. Though Panadol is from the same family of aspirin, but it doesn't help in reducing blood clotting as aspirin does. And also you don't know Panadol, whether it's can increase the bleeding chances in your brain. So please don't take Panadol or any other medication if you suspect you are having stroke. Next is, why is there time limit on clot dissolving medications or clot removal procedure? Also, could clot dissolving medication cause other side effect like hemorrhagic of the other organs? Very good question. So there's a time limit because if you give this medications after certain time, there are risk of side effects. Risk of side effect is you can bleed inside the part of the brain which is dead. So what happens when you have a stroke? The area of the brain don't have blood supply. As a result, they are very vulnerable if suddenly blood flows into that, and they can cause hemorrhagic stroke. So, and also if you come after beyond time of 6 hours, there is chance that you have maybe larger area of a stroke. And that's why we don't give, because you have a more risk of bleeding inside the brain and you can even die from that. So all the studies have shown it can be only given early part. Okay, so next question is supraventricular tachycardia. Can it lead to heart attack, stroke, and cardiac arrest? Yes. So supraventricular tachycardia is also like atrial fibrillation, but it's a bit different from atrial fibrillation because you don't have irregular heartbeat. Here you have a fast heartbeat, means your atria is beating very fast. So in that case, you can get arrhythmia because of heart beating fast. They can be reduced blood supply to brain. Then you may have stroke if you have any blockage. You can get heart attack, but you generally don't throw the clot from your heart to cause stroke, like atrial fibrillation. So yes, supraventricular tachycardia can cause you cardiac arrest. It can cause you heart attack. It can cause stroke, but mechanism will be totally different from atrial fibrillation. Next one, please. Dr. Sumit, can you please clarify why obesity is a risk factor? And if obesity is a high risk, does it mean that underweight people won't suffer stroke? Okay, so yes, how obesity causes risk? Because more obese you are, more you have cholesterol in your body, more you have fat receptors. As a result, it also increases high cholesterol in your blood vessels. Not only that, because of obesity, you may have a breathing problem, you may have a high blood pressure. This comes together. Obesity comes with many diseases together, and we call it metabolic syndrome. You may even have a high risk of getting diabetes. That's why obesity is one of the risk factors for stroke. Now, other way around, so people will say if underweight people can suffer stroke. Yes, they may suffer stroke if they are very underweight, means they are cachectic, they are losing their weight, because in that case, they may not have many nutrients inside their blood vessels. They may also have very weak heart and very weak muscles, so that they can cause stroke. So that's why you can see there is a range for BMI. It's 18.5 to 22.9. We never say you have to reduce the weight below 18.9, because as you reduce your BMI, your risk of another disease, many other diseases becomes higher. Not only stroke, even you can get heart attack and other things. Next is, hi doctor, you mentioned aspirin. If stroke occurs at home, how to give as victim aspirin before the ambulance arrives? I think I have answered this question already. I won't advise to give any medication before you go to the hospital or see the doctor, because you don't know what kind of a stroke patient is having. Can you show the second slide, how to prevent stroke again? Sure. Is there any more question? If not, then I can go to second slide. Oh, we'll take all the questions first, and then at the end, hopefully I'll remember and I'll show you the second slide. Okay, the question is, I have received a WhatsApp message regarding a person should do after suffering stroke. We should prick the stroke victim's earlobe and make sure blood comes out. Is this medically sound thing to do? Sorry, I'm not here about this any time. I don't know, maybe don't know the reason behind pricking the ear to make the blood comes out. Yes, you can prick patient or make patient to be awake when they are having stroke, because you don't want them to become drowsy, because if they become drowsy, they can start swallowing their saliva and they can become infection to the lung. But I've never heard about it, and never read also that you should pinch so hard that blood should come out. Yeah. So you should avoid, I guess, because I won't suggest for this. Next question: are the treatment of strokes, example, clot dissolving medication, catheter, etc., all done under general anesthesia? No, not all the treatment done under general anesthesia. A clot dissolving medication, patients are awake. They know it's almost like giving an IV drip or IV normal saline through your veins. So patient is awake. They may have a stroke. They may not able to move, but they are awake. It's just a small vein inside our hand. They'll put the IV plug and we can run the medications. Whereas in the clot retrieval through the catheter, many of the time we don't give general anesthesia also. We may give a small injection of anesthesia so that patient don't move or patient don't have know that procedure is being done, because when they move, there is chance that catheter may move also. But if you have very big stroke and patient is not able to breathe or patient is not able to maintain their airway, in that case, generally we do intubate the patient, put in the ventilator and use the general anesthesia to do the stroke. What check can done in hospital to confirm whether I have a stroke previously? There are many things can be done. First, we can doctors can ask you history. If not, then they can examine you and they see if any signs of stroke, previous stroke, we can pick up. And also if there, we can see the scan and scan, because once you have got stroke, it causes scar inside the brain. Even though you recovered fully, you may not have deficit, but scar is always there in a brain, which can be picked up if any brain imaging is done. If a stroke happens, what should we do beside calling 995? I told this already. Please don't drive. Don't eat or drink anything. Make sure you're awake. Make sure you nearby somebody is there so that they are monitoring yourself. And yes, and wait for 995. Next question is for you, Mr. Ananda.
Yes.
I'll read for you. And so, Mr. Ananda, from your personal experience, what is the most important factor of stroke recovery journey?
Okay, the most important thing is stress. Managing your stress is so important. Like when I had the stroke, my doctor said I had a very clear vascular system. So my doctor said I shouldn't have got the stroke. But for me, right, it was 6 months before my stroke. I was under a lot of stress. And because of the stress was the reason why I could only sleep maybe 4 hours a day. So within 6 months, my pressure had gone up. I didn't realize it because before that, I never had a problem with pressure. But when my pressure went up, I didn't realize it. And then suddenly I had the stroke. And I only knew I was having high blood pressure when I was in the ambulance. And I heard what they said about my pressure. Yeah.
There's one more question for you, Mr. Ananda.
Yes.
If someone is living alone and recovering from stroke, what would be your advice to the patient?
I think that if you're living alone, I think that is you have to monitor your health very closely, right? And if you can, it'll be good to get someone to maybe rent your room as well, so that you're not alone. And as well, you should contact. There are so many ways to prevent recurrence of the stroke by making sure you're sleeping well, you're eating and things, and there's lots of information that is available on the net, and I think it'll be very helpful if you join Singapore National Stroke Association, because there are lots of ideas. They are always sharing. They have doctors as well as professionals, that would be willing to support a stroke survivor, like me, for example.
All right, I think that's all the question we have for today. Any other question from the audience or from our speakers?
Thank you. I think there are more questions, but because of time constraints, and there are many questions are repeated, so we have decided we'll do this many questions. In
Okay.
case, yeah.
Okay, thank you, everyone. So I think that's probably the end of our sessions. Yeah.
Maybe I can just let you know also. Just ask Dr. Shamla to talk about SNSA, if you don't mind, just few words, what it does and how it can be helpful for people in Singapore if they are suspecting stroke or having stroke.
Thank you, Dr. Sumit. The Singapore National Stroke Association has been in Singapore for the past 25 years. It's a support organization that promotes stroke awareness and prevention, and also advocates for stroke survivors and caregivers living with the effects of stroke. So if you know someone with stroke, or you want more information on how to live with stroke or stroke prevention, please do check out our website and also connect with us via Facebook and Instagram. There are many activities catering for every individual. So please do go on to our website and social media accounts to find out more. Thank you.
Thank you very much, Dr. Shamala, Dr. Sumit, and Mr. Ananda for, I think, very informative sessions. I think we all learned a lot about stroke, and especially the importance of fast response. I think fast is the keyword, timing is everything. So we hope that that's a good take-home lesson for everyone today. This webinar is recorded, so we're gonna upload on our SGH YouTube about 1 week later, and we will notify everyone on the participant today, so that you can rewatch again and maybe relearn something that you missed out today. Once again, thank you so much for attending with us this Sunday morning, and we hope you stay safe and have a good Sunday. Yeah.
Thank
Goodbye.
you, everyone. Have a great weekend.
Thank you.
Thank you. Yeah,